I've been going to a doctor since I was 40 years old, keeping my check on my prostate and PSAs. In the past 3 years, my PSA had gradually increased from like a 1.5 up to a 3.4. My doctor recommended that I have a biopsy.
My dad was diagnosed with prostate cancer. The options that he had were, one, a radical prostatectomy, and the word radical should be highlighted in that, because an open radical prostatectomy, when I looked into it, large amounts of blood loss, it's a very, very brutal surgery. And that was not something that I wanted my dad to have to experience. The other choice was radiation implants. And I had the opportunity to, one, see some patients who had had some complications from that with radiation cystitis, and was just thought, no, that's not a real good option either. And the other part of that procedure that bothered me was, you don't eradicate this tumor. I've seen people who have come back 10 years post-op or 10 years post-procedure and had recurrent prostate cancer with bone metastases, and I just really didn't want to have to worry that there was any part of this cancer that would be left. And then the other option, of course, was the daVinci. And we used very small trocars to do the incision, so he didn't have an incision any longer than maybe 1.5 inches was probably the longest incision that was made. And 4 small little trocars were placed, so he has very few scars. So the word radical, although we took out the prostate, the word radical didn't come into my mind. And the thought that we were going to ever have to worry about this again was relieved as well. So, there was really, for me, no other option other than the daVinci.
That did help me to decide to use Dr. Sadiq. At the time that I was prepared for surgery, I was at peace with having surgery. It was one of the, I was very calm. I had a lot of confidence in what was happening, what was going to happen. It just like a peace that was over me that I had no problems. I went home on the second afternoon. My pain level was very low. I think I took a total of 3 pain pills through the whole procedure.
He was up and walking, I think on day 3. He tried to go 2 miles, and my mother was calling me on the phone telling me that Dad's walked to the road and back, and she told me that she hid his tennis shoes from him so that he couldn't do that again. And so I asked Dr. Sadiq the next day at work, well, what do you think, is this okay? And he said, well, don't stop him. If he feels like he can do it, let him go. Maybe 2 miles might not be the best thing, but if he feels good, let him go. And so, I told Mom, look, give him his shoes back. He's going to be okay.
I went back to work on the 4th week, 3rd week for a half a day after surgery. Went back full time on the 4th week, and I've been cutting wood, riding my tractor, doing what an old man needs to do, I guess.
We came back with a PSA of 0, so we know the prostate is eradicated, and this is not a thought that we ever have to worry about coming up again.